Hi, welcome to the Victoria Alliance Against Chronic Kidney Disease. My name is Sam Jarrett, and I operate a clinical nutrition practice here in Victoria, Texas. This educational segment will focus on the many underlying factors that impact not only kidney disease, but many other medical conditions that may interact with each other in some way. So let's go ahead and jump right in. Today, I would like to talk about the impact of obesity on your health and your body. We'll start with the big question is, what is adiposity? Adiposity is simply just being overweight. Excess weight impacts diseases in many different ways, not only chronic kidney disease, but many others. So we'll look at a few of those today. The first thing we're going to look at is a few of the protein hormones. Adiponectin is a protein hormone that is produced by fat cells. Its physiological effects include the reduction of inflammation and arthrogenesis, which is the formation of fatty deposits in your arteries, and the enhancement of the response of cells to insulin. The next one is leptin. Leptin is a protein produced by fat cells that is a hormone acting mainly in the regulation of appetite and fat storage. Resistin is also known as adipose tissue-specific secretory factor, a cysteine-rich peptide hormone derived from adipose tissue that in humans is encoded by the RETN gene. Then visfatin. This is a newly discovered adipocyte hormone with a direct relationship between plasma visfatin levels and type 2 diabetes, and is preferentially expressed in visceral adipose tissue. When you have an increase in insulin resistance, increase in inflammation, increases in oxidative stress, and you have abnormal lipid metabolism, these adipokines function as classic circulating hormones to communicate with other organs, including brain, liver, muscle, the immune system, and adipose tissue itself. The dysregulation of adipokines has been implicated in obesity, type 2 diabetes, hypertension, and cardiovascular disease, all of which have a direct impact on chronic kidney disease. This is a before and after scan of a patient who shed 13% of his body weight and 34% of visceral fat. Now this red area on the left here is visceral fat or adipose tissue. This is the metabolically active fat. We call it a dangerous type of fat because it does lead to things like hypertension, cardiovascular disease, hormone imbalance, high cholesterol, type 2 diabetes, insulin resistance, and other factors. So it's important to reduce this. The scan on the right reveals just how much of the red area of visceral fat is reduced by diet and exercise. So that's our goal, reduce the visceral fat. So the next one here is obesity-related factors. The many things obviously affect chronic kidney disease. Things like insulin resistance and hyperglycemia, free fatty acids and dyslipidemia, fatty acid triglyceride accumulation and toxicity, hypertension, low amounts of vitamin D, increased cortisol, increased oxidative stress, Also, dysfunction of leptin and adiponectin resistant items as well. Those are going to cause some problems with kidney disease. Other things like nutrition, hormones, neural and genetic factors affect chronic kidney disease. Now, disease is influenced by gut microbiota. Not only obesity, but type 2 diabetes and many more. So let's talk about dysbiosis of the gut microbiota. Gut microbiota is one of the most recognized factors playing a critical role in obesity and disease development. If you have an intestinal barrier defect or a dysregulated immune response, impaired gut-brain axis, altered metabolic signaling, any of these that can pass through the gut barrier will start to impact all of these different types of health conditions, including Crohn's disease, ulcerative colitis, IBS, anxiety, depression, of course, kidney disease, type 2 diabetes, obesity, allergies, colorectal cancer, and more. The good thing about all of this is the fact that probiotics have been shown to improve metabolic health by lowering body weight and fat mass, reducing inflammation, improving glucose control, and increasing the health-promoting bacteria in our gut. So if you have an impaired gut barrier function, the things that are going to impact that, if you have a bad diet, that diet will increase fermentation in the stomach and intestines. That will release toxins and toxicity. Those will go through the gut barrier, the gut barrier, and cause inflammation, and those will start to increase the progression of chronic kidney disease, cardiovascular disease, PEW, or protein energy wasting, immune dysregulation, and central nervous system toxicity. Dysbiosis typically occurs when the bacteria in your gastrointestinal tract becomes unbalanced. So the key to this is to rebalance that. So we're going to look at the expanded and inflamed visceral adipose tissue. This here is adipose tissue in this upper left-hand corner. It's inflamed, so once you have inflammatory cytokines, you wind up with insulin resistance, not only within the adipose tissue, but also within the liver. Those things can turn into things like chronic low-grade inflammation and enhanced oxidative stress, hypercoagulation, hypofibrinosis, arthrogenic dyslipidemia, which is the increased triglycerides, lower HDL, increased small, dense LDL cholesterol, and insulin resistance. All of this winds up impacting the kidney and leading to chronic kidney disease. So today, we know for a fact that the modern Western diet promotes obesity. Beneficial microbiota is decreased as a result of this particular diet, and obesity is increased. To help reduce this, we're looking at a probiotic diet as a future solution for obesity that would increase the beneficial microbiota within the system and would help to alleviate some of the disease factors that we looked at before. So diet is a precursor to a lot of the health conditions that we all face and work with. So how does diet affect kidney outcomes? The American Society of Nephrology did a study, 18 actually studies, of 630,000 adults and found essentially that a healthy diet patterns encouraged a higher intake of nuts and whole grains, low-fat dairy, fruits and vegetables, legumes, fish, things of those natures. And then they encouraged a lower intake of processed meat, red meat, sugar-sweetened beverages, and sodium. The conclusion was that a healthy dietary pattern may prevent chronic kidney disease and albuminuria. A healthy diet pattern was associated with a lower risk, or lower incidence actually, of kidney disease, and was associated with a lower incidence of albuminuria. So how do we manage this? We recommend a screening every 3 to 6 months. This includes a periodic nutritional screening, weight management. We look at weight, BMI, waist-hip ratios. I like to do a comprehensive body composition assessment to actually know what our body fat content is, what our skeletal muscle mass looks like, what our body water content is, what essentially makes up our weight, and then we'll watch that over a period of time. There will be continuous preventive measures, a lot of nutritional counseling, optimization of your dietary nutrients, management of comorbidities. So if you are overweight and you have diabetes and sleep apnea or any combination of other health conditions, we need to look at all of those. Then we look at indications for weight management or interventions despite the preventative measures. If we see weight gain continuing and we don't see any more additional physical activity, or our waist-hip ratios are increasing, then we need to look at weight loss strategies. Those strategies would include things like dietary interventions, exercise interventions, and maybe alterations in food content. If those things lead to improvements, then we look at helping to continue with weight maintenance, balancing the calorie intake, continuing physical activity. And then if we're not seeing improvement, then we look at intensified therapies like pharmacological interventions, potentially bariatric surgeries. There are adjunct therapies that we can look at, like salt restriction, heart-friendly diets, and resistance exercises. So new research gives us another reason to get up off of our desk and chairs and get moving. Findings published in Cell Physiology suggest that the pressure placed on the buttocks and hips from sitting down for too long can generate up to 50% more fat in those areas. So we need to get up and get moving. Here are some simple prevention tips. Number 1, sit less and stand more. Recent research has linked sitting for 8 hours or more a day with developing kidney disease. Exercise and lose some weight. Diabetes is responsible for 44% of new cases of kidney failure. Obesity and type 2 diabetes are on the rise and can often be treated and reversed with physical activity and weight loss. Manage the high blood pressure. Both considered silent killers, many people don't realize that high blood pressure and kidney disease are linked. Controlling blood pressure levels can prevent kidney damage and kidney failure. Also, avoid long-term use of kidney toxic drugs such as over-the-counter pain medications, NSAIDs such as ibuprofen, with brand names such as Motrin, Advil, and Nuprin. We need to be very cognizant of these type of drugs. Lastly, get tested. Ask your healthcare provider for an annual urine test to check for protein in the urine. This is one of the earliest signs of kidney disease. And a blood test for creatine to calculate your estimated filtration rate, or eGFR. GFR tells how well your kidneys are working to remove wastes from your blood. So that's it. I want to thank you all for watching. If you would like a copy of this presentation or have additional questions, please contact me at the clinic or at the email address on the screen or that you see below. We've been involved with the Alliance for Kidney Chronic Disease for at least a couple of years, and I'm happy to be able to provide this presentation and educational section for you. Again, thank you all for watching, and we hope to see you soon.